Hello, my name is LaShonda Donaldson, and I'll be doing my PowerPoint on the opioid epidemic in the United States. Okay, the objectives. By the end of this presentation, 95% of the audience will be able to identify at least 2 signs and symptoms of opioid abuse. By the end, they will be able to, 100% will be able to list 2 opioid drugs. 85% of the audience will be able to identify suspected opioid drug abuse. And the other 90% of the audience will be able to discuss in their community ways to make a difference. What are opioids? Opioids are drugs prescribed usually to prevent and reduce pain levels. Opioid addiction is characterized by a powerful urge to use drugs even when they are no longer prescribed. Opioids can change the chemistry of the brain and lead to drug tolerance, which means that over time the dose needs to be increased to achieve the same effect. Opioid addiction can cause life-threatening health problems, including the risk of overdosing. So what are opioids? What kind of drugs are opioids? Opioids drugs are considered as like codeine, hydrocodone, morphine, oxycodone, hydromorphine, fentanyl, tramadol, and methadone. Probably the most one that you're going to see prescribed is the codeine and the hydrocodone. Those are the most common ones that I see, being that I work on a mental health unit. Like most people come in, they come in and they want drugs for pain. Most of them don't want Tylenol, ibuprofen. That's usually what the doctor ordered. But most of them be wanting cocaine and hydrocodone. And it's very rare that someone gets codeine or hydrocodone. I have seen someone get tramadol shots, but they have to have like chronic severe pain. Okay, so what are some signs and symptoms of opioid abuse? You can have poor coordination, drowsiness, be irritable, depressed, make poor decisions, abandon your responsibilities. You can have slurred speech. You can sleep more or less. You can have mood swings. Give you like euphoria, which is like feeling high. You can be, it can cause like shallow or slow breathing, nausea, vomiting, constipation, and so on and so forth. Also, you can have like anxiety attacks. Like some people like start having like real life withdrawals because they haven't had the medication or whatever. And on our floor, they usually get them like an Ativan taper to kind of help with the anxiety and the withdrawals of the medications that they was taking before they came into the hospital. So did you know? Let's talk about some facts. The number of drug overdose deaths decreased by 4% from 2018 to 2019. Nearly 70% of the deaths involved in 2018 was from opioid misuse, which is crazy. Roughly 21 to 29% of patients prescribed opioids for chronic pains misuse them because they get so used to taking them that they start taking more and more and more because their body becomes tolerant to the medication. 8 and 12% develop an opioid use disorder while taking the medication. What's being done to help the opioid crisis? So they are improving access to treatment and recovery services, promoting use of overdose reversing drugs, strengthening the understanding of the epidemic through better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. Do you know how to assess if someone is having an opioid addiction? So it's like several questions that you could ask, and I'm going to go through only a few of those. So you can ask like, have they used opioids? Have the use of their opioids increased over time? Have they put off doing things because of their drug use? Do they find themselves thinking obviously about getting or using the drug? Have you made unsuccessful attempts at cutting down your drug uses, and so on? So if someone answers yes to at least 3 of the questions, there's a chance that they could have an opioid abuse, opioid drug abuse. So risk factors. What puts people at risk for this? Family history, age, external influence, emotional issues, body chemistry. The risk increments for chronic pain patients who show a high level of tolerance to the drug, which I stated previously. So what can you do to help? So you can provide misusers with drug addiction information, inform the patients of another form of pain relief, such as, trying to relax or exercise if it's not pain that interferes with being able to exercise. Sometimes like a massage help, and people who have to have the drug or feel like they're going to abuse the drug, you can provide them with a hotline on opioid crisis for the drugs. Are there any questions? Now I would do like if we had questions and I had an audience, I would ask them, do they have any questions? If they have some, I would answer their questions. But since I don't really have an audience, this will be the end of my presentation. The end. Thank you.